If you experience sudden chest pain or significant discomfort in your upper body, the very first physical action you take, specifically how you position your body, can dramatically reduce the workload on your heart while you wait for medical assistance. There is a specific, medically recognized posture that uses gravity to protect the heart muscle, and learning it now ensures you can assume it instantly if the need arises. The floor sit. The single most important safety rule when dealing with chest pain is to get low immediately. Do not try to sit in a chair, and do not try to stand up. While a chair may seem comfortable, it presents a significant danger during a cardiac event. If you were to lose consciousness or faint, which is a common occurrence due to drops in blood pressure, you could fall from the chair and sustain a secondary injury, such as a head trauma or a hip fracture. Being on the floor eliminates this risk entirely. Move to the floor in a calm, controlled manner. Find a space where you have a wall, a sturdy sofa, or a heavy piece of furniture behind you. You want to be on a firm surface. Soft beds can sink, making it harder for you to breathe effectively and making it difficult for emergency responders to assist you if they need to perform CPR. The floor provides a solid, stable foundation. This works well for most older adults. Being on the floor also sends a clear signal to anyone who enters the room that something is wrong. It is an unusual place for an adult to be sitting, which communicates urgency without you needing to speak. Furthermore, lowering your body reduces the gravitational stress on your circulatory system. When you are standing, your heart has to pump blood vertically against gravity to reach your brain. When you are low, that demand is slightly reduced. This helps the body function more easily. If you have knee issues or mobility problems that make getting to the floor difficult, you must prioritize safety. However, if you are able to get down, it is the safest place to be. It prevents the fall before it happens. It secures your physical safety so you can focus entirely on your breathing and keeping your heart rate down. Most older adults can manage this. Once you're on the floor, you are in the control position. You have removed the variable of balance. You no longer need to use your leg muscles or core muscles to keep yourself upright against the risk of a stumble. You are grounded. This grounding allows your body to redirect energy away from posture maintenance and toward organ function. This fits into any routine. Practice getting down to the floor and back up again when you are feeling well. Knowing that you can do it builds confidence. In an emergency, muscle memory takes over. You want your body to know exactly how to slide down safely to a seated position against a wall. The 45-degree back lean. The next vital step is to establish the correct angle for your upper body. Once you are seated on the floor, lean back against the wall or sofa. The ideal angle is approximately 45 degrees. This is halfway between lying flat and sitting bolt upright. This specific angle is often referred to in medical terms as the semi-Fowler's position, and it is chosen for very specific physiological reasons regarding how blood returns to the heart. Do not lie flat on your back. When you lie completely flat, the volume of blood returning to the heart from the rest of the body increases. This is called preload. If your heart is already struggling or in pain, flooding it with a high volume of returning blood forces it to pump harder to clear that blood out. This adds unnecessary stress to the heart muscle. Lying flat can also make it harder to breathe if there is any fluid congestion in the lungs. This is simple to do. Conversely, do not sit perfectly straight up at a 90-degree angle. Sitting too upright can sometimes cause the abdominal contents to push up against the diaphragm, restricting the bottom of the lungs. The 45-degree lean is the Goldilocks zone. It reduces the return of blood just enough to lighten the load on the heart, but keeps the chest open enough for maximum oxygen intake. This helps reduce stiffness. Use pillows, cushions, or just the slope of a sofa to support this angle. The goal is to be supported passively. You should not be using your stomach muscles to hold yourself up. You must be able to lean your full weight back against the support. If you are holding yourself up, you are burning oxygen. Lean back completely and let the wall do the work. This keeps the body balanced. This position also helps with the psychological aspect of panic. It feels like a resting position. It signals to the brain that you are taking a break. Lying flat can sometimes induce a feeling of vulnerability or suffocation, while sitting upright can feel like you are still active. Leaning back allows the head to rest against the wall as well, relaxing the neck muscles. Most older adults can try this safely. If you are alone, you can pile pillows against a wall or sit at the base of your bed, leaning against the mattress. The support must be stable. Do not lean against a lightweight chair that could slide away. You need to trust the structure behind you so you can close your eyes and focus on slow breathing. This fits easily into the plan. Check your comfort. If you feel dizzy leaning back, adjust slightly, but aim for that semi-reclined posture. It is the standard position paramedics will likely place you in when they arrive, so getting into it early gives your heart a head start on recovery. The knee bend. Here is another simple habit regarding your legs that completes the safety posture. Once you are leaning back, bend your knees. Place your feet flat on the floor. Your legs should form a triangle shape. This is often called the W position. Knees up, bottom down, back leaned. Do not keep your legs straight out in front of you. Keeping legs straight can put tension on the lower back and the hamstring muscles. When the legs are straight, the abdominal muscles often have to engage slightly to stabilize the pelvis. You want your abdomen to be completely soft to allow for deep breathing. Bending the knees releases the tension in the psoas muscles, hip flexors, and the lower back. This works well for most older adults. Bending the knees also serves a circulatory function. It helps to settle the blood in the lower body gently, preventing it from rushing back to the heart too quickly, which supports the goal of reducing the heart's workload. It creates a very stable base. With your feet flat on the floor and your bottom on the ground, you are anchored. You cannot slide forward easily. This helps the body function more easily. This position allows you to relax your thigh muscles completely. If your legs are straight, your quadriceps are often active. When your feet are flat, you can let your knees fall slightly open or keep them neutral, whichever feels more natural. The key is that no muscle in the leg is holding tension. This is easy on the joints. If you are wearing shoes that are tight or heavy and you can easily kick them off without straining, do so. But if untying them requires bending over and compressing your chest, leave them on. The knee bend is more important than the footwear. Just get those feet flat. Most older adults can do this comfortably. This position is also excellent for communication. If you need to speak to a dispatcher or a family member, this stable base allows you to project your voice without straining your core. You are compact and secure. This keeps the body balanced. If you feel your legs shaking, which can happen due to adrenaline, the contact with the floor helps steady them. Press your feet gently into the ground. This sensory input can be grounding and help reduce the physical sensation of anxiety. The arm drop. Another helpful step involves the position of your arms and shoulders. Our natural instinct when we are in pain or frightened is to tense up. We often hunch our shoulders up toward our ears or clench our fists against our chest. This tension is counterproductive. It tightens the muscles of the upper chest and neck, which are accessory muscles for breathing. When these muscles are tight, they restrict the rib cage from expanding fully. Let your arms drop loosely to your sides. You can rest your hands on your thighs or let them rest on the floor beside you, palms facing up. The critical action is to actively drop your shoulders. Visualize your shoulders melting down away from your ears. This fits into any routine. When your shoulders are down and your arms are supported by your legs or the floor, the weight of your arms is taken off your chest wall. This allows your ribs to move freely. Chest pain often makes people take shallow, panicked breaths. By releasing the arms, you mechanically allow the chest to open up for deeper, slower breaths. This helps reduce stiffness. Do not cross your arms over your chest. Crossing arms is a protective posture, but it physically compresses the chest cavity. It adds weight to the very area that is trying to expand. Openness is the goal. Open hands, open arms, open chest. This is simple to do. Check your hands. Are you making fists? Open them, wiggle your fingers. Clenching your fists raises your blood pressure slightly. It is an isometric exercise that consumes energy. Relaxed hands signal the rest of the body to relax. Most older adults can try this safely. If you are holding a phone to speak to emergency services, try to rest the elbow of that arm on your thigh or the floor. Do not hold the phone up in the air with a tense shoulder. Support the weight of the arm so the shoulder remains relaxed. Use the speakerphone function if possible so you can place the phone on the floor next to you and keep both hands empty. This keeps the body balanced. The position of your arms affects the space in your chest. By placing your hands on your knees or the floor, you create a tripod effect, if seated forward, or a relaxed open chain, if leaning back. In the semi-reclined position, resting hands on the thighs is usually the most comfortable. It feels composed and deliberate. The neck release. One more easy change you can make immediately is to remove restrictions around the neck. Clothing can become a surprising hindrance during a health event. If you are wearing a tie, a scarf, a button-down shirt with a tight collar, or a necklace, these items can press against the throat and the carotid arteries. Loosen the top button of your shirt or remove the scarf instantly. The goal is to ensure there is absolutely no pressure on the windpipe or the large blood vessels in the neck. Even slight pressure can increase the feeling of breathlessness. The sensation of air on the skin of the neck can also be cooling and calming. This works well for most older adults. Psychologically, loosening a collar helps reduce the feeling of choking or suffocation that often accompanies chest discomfort. It signals to your brain that the airway is completely clear. It removes a barrier. This helps the body function more easily. Do this slowly. Do not frantically rip at your clothes, as this exerts energy. Calmly reach up, undo the button, loosen the tie knot, or unwrap the scarf. Place the items on the floor. This is simple to do. If you are wearing a heavy coat or jacket, unalign it or take it off if it is easy to do so. Heavy clothing adds weight to the chest. However, do not struggle to remove a tight sweater if it requires flailing your arms. Just loosen what is easily accessible at the neck. The priority is the airway. Most older adults can manage this. This action also prepares you for the paramedics. When they arrive, they will likely need access to your chest to place monitoring pads or listen with a stethoscope. Having your outer layers loosened or open saves time and makes their job easier. You are proactively preparing for your care. This keeps the body balanced. Temperature regulation is also a factor. People often break out into a cold sweat during cardiac events. Loosening clothing around the neck allows heat to escape and air to circulate, which can prevent you from overheating and feeling faint. The belt release. Here is another simple habit regarding your clothing that aids breathing. Just as the neck needs to be free, the abdomen needs to be free. The diaphragm is the primary muscle of breathing. It sits at the bottom of your rib cage. When you inhale, the diaphragm moves downward, pushing against your abdominal organs to make room for the lungs to fill. If you are wearing a tight belt, a firm waistband, or control top undergarments, this downward movement is restricted. Unbuckle your belt or unbutton the top of your trousers. You need to create space for your belly to expand. This is diaphragmatic breathing. If the belly cannot expand because of a belt, the diaphragm cannot move down, and you are forced to use only the upper chest muscles to breathe. This is less efficient and more tiring for the heart. This fits into any routine. Releasing the waistline pressure allows for a full, deep breath with less effort. It reduces intra-abdominal pressure. When you are in pain, you want every breath to be as easy as possible. You do not want to fight your clothing to get oxygen. This helps reduce stiffness. Do this immediately after you sit down. It is part of the settling in process. Sit, lean back, unbuckle. It provides instant relief. It allows the organs to settle naturally without compression. This is easy on the joints. Again, do not worry about modesty in this moment. Your health is the only priority. Emergency responders are professionals. They do not care if your pants are unbuttoned. They care that you are breathing well. Most older adults can do this comfortably. If you are wearing a dress or elastic waist pants, simply ensure the band is not digging in. If it is tight, push it down slightly to the hip level where there is less pressure on the soft stomach area. The goal is a soft, unrestricted abdomen. This keeps the body balanced. This release also helps with digestion-related chest pain. Sometimes severe heartburn or gas can mimic heart pain. Releasing the belt helps in those situations as well, so it is a good universal rule for chest discomfort. It gives the digestive tract room to normalize. The statue rule. Another helpful step is behavioral. Commit to absolute stillness. Once you are in the position, seated on the floor, leaning back, knees up, clothing loosened, you must become a statue. You must stop moving. Do not pace the floor. Do not walk to the bathroom. Do not get up to unlock the door. We will address this in the next point. Do not rummage through drawers. Every time you move a muscle, your body requires oxygen. Your leg muscles are large. Walking across the room consumes a significant amount of oxygen. If your heart is the source of the pain, it means the heart muscle itself is currently deprived of oxygen. You cannot afford to spend oxygen on walking or pacing. You must save every bit of it for the heart. This works well for most older adults. Anxiety makes us want to move. We want to pace to work off the nervous energy. You must fight this instinct. Force yourself to stay glued to that spot on the floor. Visualizing yourself as a statue helps. This helps the body function more easily. If you need water and it is not within arm's reach, do not get up for it. Wait. If you need aspirin and it is in another room and you are alone, you have a difficult choice. If you can call out to someone, do so. If you must move, crawl slowly rather than standing and walking. But ideally, once you are down, you stay down. This is simple to do. Closing your eyes helps with this. When you close your eyes, you shut out visual stimulation, which can help quiet the urge to do things. Focus entirely on the sensation of the floor beneath you and the wall behind you. Most older adults can try this safely. This stillness also lowers your heart rate. Movement raises heart rate. Your goal is to keep the heart rate as low and steady as possible. Stillness is the best medicine you can administer to yourself in that moment. This keeps the body balanced. Tell yourself, my job right now is to do nothing. Reframing doing nothing as an active, helpful medical intervention makes it easier to comply. You are not being lazy, you are being strategic, you are preserving fuel. The open airway source. One more easy change is preparing your environment before you sit if possible. If you are alone when the pain starts, you have one brief window of activity before you assume the safety position. You need to ensure help can reach you. Unlock the front door immediately. Do not wait until the ambulance arrives. You may not be able to get up then. If you are near the door, unlock it, crack it open slightly, and then sit down in the hallway or the nearest safe spot. This ensures paramedics do not have to break down the door, which saves precious minutes. This fits into any routine. If you cannot get to the door safely, do not force it. But if you are mobile when the pain strikes, this is the first action. Also, if you are in a stuffy room, open a window. Fresh air can reduce the feeling of nausea that often accompanies chest pain. The flow of cool air is physically refreshing and helps reduce the panic response. This helps reduce stiffness. Do not worry about security in this specific moment. If you have called 911 or your local emergency number, help is on the way. An open door is an invitation for rescue. This is easy on the joints. If you have a life alert type button, press it immediately. If you have a phone, bring it down to the floor with you. Do not leave the phone on a counter where you cannot reach it. The phone is your lifeline. It stays in your hand or on your lap. Most older adults can do this comfortably. Once the door is unlocked and the phone is with you, return to the W position and initiate the statue rule. You have done everything you can physically do. Now you wait. This keeps the body balanced. Knowing that the door is open reduces your anxiety. You do not have to worry, will they hear me? Can they get in? You know they can. This peace of mind allows you to relax into the supporting wall and breathe. By combining these simple actions, you create the optimal environment for your heart. You use the floor for safety. You use the 45-degree angle to manage blood flow. You use the knee bend to stabilize the back. You use the arm drop to open the chest. You use the clothing release to assist the lungs. You use stillness to conserve oxygen. And you use the unlocked door to ensure rescue. If you know someone over 50 who could benefit from this, share this video and subscribe for more simple health tips.